And now, Dental Bites, with the dental hygienists of Dental Post.
Hey everybody, and welcome back to Dental Bites. I saw something pretty cool, guys, on Kim's Bloom RDH Instagram, and it totally caught my eye, and it really made me think back and actually maybe even think now. But Kim, you posted something about new grad feelings, and I gotta tell you, I connected to almost all of them. Will you tell Allie and Tina about what that post was all about?
Yes, absolutely. So as you know, I work primarily with new grads, and I experience their feelings and remember that I had all of the same feelings. So I made a post, and I'll just read it for you because, I also teach in school and we're all so busy, but I find that we don't spend enough time talking about, and these were kind of what they said, how lonely you will feel in your operatory as a new grad, and I know for me, really, how deeply you're going to internalize, that first hurtful comment that you get.
When they don't want to see you? Oh, that's so awful when they don't want to see you.
Right? The first time you get that, it's terrible. Now, I mean, no, it's not a big deal.
Now you're like, thank goodness I didn't want to see you either.
Exactly. Or right. Or how hard it might be to discuss treatment with a patient.
Well, because when you're just graduating, you don't understand treatment. I didn't understand treatment.
Understand treatment at all. This was a really hard one for me too, is the pressure that you'll feel from a doctor who expects perfection from you to find those treatment needs. That was a really hard one for me. I worked for a perfectionist outside of school.
I did too.
And then how your body's going to feel after your first week working full time, because right? I mean, every bit of me hurt seeing 8 patients a day, 4 days a week. So I put that post out there just recently, and I was pretty surprised at all of the responses and feedback that I got from the post. So I'm just curious, has anybody else felt those feelings?
I gotta tell you, my first couple months into hygiene, I remember sitting down with some friends and I'm like, this is wrong. I screwed up. Like, I made it through, hygiene school, and here I am. And I immediately, I got my license in August, and actually within weeks, I was already in a master's program because I was like, I clearly need to get a master's degree because I need to get out of this. But once I hit that 6-month mark and I started seeing the patients again, and they knew who I was, and I wasn't trying to convince them that I knew what I was doing. By then I, knew some of the treatment stuff, and then I started to fall in love with it. But it really, like, that first 6 months, and I joined a study club. This was before, I was in the 1900s. So this was before Zoom, we didn't have really the internet. Sorry. But one of my local periodontists had a local hygiene study club. And when I was able to get together with other hygienists, first off, to understand like, oh, your neck hurts too? Like, okay. And some tips. And then talking about treatment and talking about, all the patients hate me. They're like, girl, the patients don't hate you. Like, don't, but having that community. So I think part of it, I would say, like, just wait it out a second, but also find some community. Darn it all. Like, you need, particularly if you're a lone hygienist, you need that community, because otherwise you are like, it is lonely, and it is easy, particularly if you have that perfectionist dentist, which I also had. It is easy to just tear yourself to pieces. So yeah.
And that's exactly what I did after graduation. Yeah. And that's really what led me on this path that I am now, because I do feel, when we're in hygiene school, we're around our instructors, we're around our classmates. It's really this, almost sorority-like feeling, and we're all going through it together, and then you're alone. So that was really my push to start Bloom RDH and create a community and create a sense of belonging, so that you can know that what you're feeling is normal and you have others to go through it with you.
Talking about that, it makes me think, takes me all the way back to like my first day as a hygienist, where I got paid to do this, right? It's like, I'm paying to do all of this stuff. Now someone's going to pay me to do this, right? And I was working with a piece of equipment I had never worked with before. Right. When I was like, again, I went to school in the 1900s, transitioning to the 2000s, and I learned doing x-rays with this lead collimator, right? So this big heavy thing. And then I go into an office and they have an XCP. And I'm like, I don't know. And it took me like 10 minutes to try to figure it out. And the doctor's walking by, pacing, waiting, right? For me to be able to take the image off of this patient in the old traditional, like this is like, right? Traditional, like hard cardboard film that I'm trying to do. And I was like, I remember holding back the tears, fighting them, going, what did I just get myself into? I don't know what I'm doing. I can't even take an x-ray on somebody. And I'm making the patient anxious and mad. I'm making the doctor mad.
That was so not cool of the doctor. I'm going to call, I'm going to throw a flag on the play because I got to tell you, tech, I don't care how long you've been a hygienist. I'm coming on 30 years now, and I can't walk into somebody else's office and know how to use their machines, man. That's a total utter flag on the play there. That's not cool, bro.
Well, it wasn't cool. Looking back, right? Yeah. I can look back and say, "Oh, sweet."
But you're not going to ask for help at that point because you're then I look even more inexperienced. Then I look like more of an idiot.
Yeah, and needless to say, I was not asked to come back and temp at that office again.
If there's a new grad watching this, I'm going to tell you, ask for help, and don't feel bad. Don't be like, because I'm a new grad, I have to ask for help. No, we all 4 of us here would have to be like, how does this machine work? Because it's not the same as on the machines.
Yeah. A senior hygienist with 20 plus years experience, if they start in a new office, new environment, new equipment, new patients to them, they also need to be trained. It's not like you only need trained when you're a new grad. Like, no, everyone at all times needs trained at some point in their career, especially if they're starting a new office.
And that 20-year seasoned hygienist will get the exact same statements. Well, you're not Sally Sue who took care of me last time. What happened to her? I liked her. I want her back. Yeah. Where'd she go?
My favorite is when it was you. You're like, no, it's me.
All the time.
You're like,
I have been here 6 years. My name's Sally. I've seen you 12 times.
Or at the end of the appointment, like, you were a lot better than that last girl, and you're like,
yeah, I was.
Yeah, that you just zip your lips.
Yeah.
Well, thank you so much. I'm so glad that you trust me with your care. I appreciate that.
Yes. But getting that first comment, I talked to so many new grads that are like, they didn't like me. What did I do wrong? And you just have to realize that you're not going to be for everybody, and everybody's not going to be for you.
Exactly. I remember my first critique, I would say, my first month on the job, where in the same week I got a complaint saying I was too rough, and then the next complaint said I was too gentle and didn't do a thorough cleaning. And I am in turmoil, like I don't know what to do. Like I'm too rough, I'm too soft. And just like I said, you're not going to be for everyone. And the more that you see these patients, especially if you want to be established in that office, you will get to learn the quirks of each patient and write very detailed notes about that patient. If they make a comment of like, oh, that,
they like it rough.
They like it rough. Don't say it just like that. Like, don't be afraid to go in there. And, make yourself a note so okay, I know what to do specific for this patient. And that way, when you see them, you're able to just get a better kind of flow for your day. You learn them, they learn you, and it just goes smoother.
That's awesome advice, Allie.
Yes.
You're spot on.
I've been criticized too many times, I guess.
Okay. We all have.
Oh, gosh.
Well, I think this was an awesome bite. So new grads and seasoned hygienists, I think we all can relate to some of these feelings, and don't get yourself down in the dumps about them. Let them roll off, but find your community so that you can laugh about them, because I think that's the only way we're going to get out of this alive.
Yeah, absolutely.
And Kim, thanks for doing what you do to support everyone. I think that's pretty awesome what you're putting out there.
Thanks. They're my faves.
Well, join us for another episode of Dental Bites down the road. Keep an eye out, because we're sure to talk about fun stuff, and let us know your experiences. What's the worst critique that you've gotten?
Oh, that would be interesting to read. All right, bye everyone.